If you're new here, this is your trusted guide for all things Medicare. Today we're diving into an important topic, Medigap and medical underwriting. First things first, let's talk about the Medigap open enrollment period. During that time, getting coverage is simple. No medical questions, no underwriting, and the same goes for guaranteed issue periods. But what happens outside of these windows? That's where underwriting comes in. The good news is you don't need a physical exam, but you will need to provide answers for a medical questionnaire. What kind of questions might you face? Well, let's take a look. Pending procedures. Have you been recommended or scheduled for any non-routine testing, treatment, follow-up, or surgery that's not yet done? Repeated hospitalizations. In the past 24 months, have you been hospitalized or visited the emergency room 2 or more times? Knockout drugs. You'll need to list your meds for the past 18 months and why they were prescribed to you. Each insurance company has its own unique Medigap application, so these questions vary between carriers. Let's talk about some common reasons applicants get declined. Conditions like diabetes, heart disease, stroke, or cancer are often red flags for underwriting. If you have pending medical procedures, consider the timing. Insurers are cautious about issuing coverage right before costly tests or surgeries. Major surgeries or health events like cancer may require a waiting period for an application to be considered, sometimes up to a year or two. And if you've been receiving home health care, visited the ER multiple times, or you live in an assisted living or nursing home, well, approval is going to be trickier if it's even possible. One more thing to keep in mind is that insurance carriers have access to a Medical Information Bureau report. It's sort of like a credit report, except it's about your medical and prescription history. They have lists of medications that could lead to automatic declines, typically those treating significant or chronic illnesses. Keep in mind that honesty and transparency makes the process smoother and helps avoid unpleasant surprises. Remember, they can quickly spot red flags. So there you have it. Navigating Medigap outside of the enrollment windows can be challenging, but understanding the underwriting process can make it easier. As always, if you have any questions or need personalized advice, feel free to reach out. See you next time.